Now, when we look at the physical effects of alcohol on the body, alcohol is the causation of more than 60 medical conditions. That means those medical conditions are directly related to the heavy alcohol use. So, alcohol on the brain can cause depression and anxiety because it is a depressant drug, but it can also cause anxiety because of how it acts on the brain. It can cause strokes because of the lack of blood flow or the not cleaning the blood out. It can cause memory loss. It can cause oral cancer, especially when it is combined with smoking marijuana or cigarettes. It can cause breast cancer, heart disease, high blood pressure. And people say, well, how can it cause high blood pressure when it's a depressant and it's depressing everything in the central nervous system? Well, at first it will lower blood pressure. But after a while, when the liver stops functioning properly, then the body, the blood is not cleaned like it should. It's causing the heart to work harder and the lungs to work harder, and it's causing high blood pressure. It can cause gastritis, all kinds of stomach problems, and in the gastric system, liver damage. We hear a lot about fatty liver in people who drink heavily, hepatitis, which is an inflammation of the liver, cirrhosis, and the word cirrhosis simply means scarring, and cancer of the liver. Now, the reason that it causes that problem in the liver is because our liver is like an oil filter. If you think about the oil filter in your car, if you don't change your oil like you're supposed to, it starts affecting the oil filter, and the oil filter starts getting clogged up. And then it doesn't process the oil properly, so then the oil gets dirtier and it gets thicker. So then your car's not going to run right. So what happens in the liver is actually a filter. Its purpose is to filter impurities out of the blood. And with alcohol is very caustic, and it causes, when it goes through the liver, it causes little lesions in the liver. And we all know if we get a cut on our hand, we're likely to have a scar, even if it's a little tiny scar. So what happens in the liver, when it gets these little lesions, they scar over. And after a person has been drinking heavily for a long time, it has a lot of scarring and the liver does not function right. And then it may become blocked up. And that's where cirrhosis starts occurring. Not everybody who drinks heavily gets cirrhosis. We all react differently. But a percentage of people that do drink heavily get cirrhosis, or they get fatty liver. And that also increases the risk of liver cancer. Pancreatitis is because of the problems with the stomach, because of the damage done to the stomach with alcohol. It can cause the little valve that releases stomach acid to digest food to become inflamed. And then it doesn't release the stomach acid. It produces it, but it stays in the pancreas. And that stomach acid inflames and damages the pancreas. So people that get pancreatitis, it is a very, very painful, even it can be deadly disorder, and they usually end up in the hospital. We know that heavy alcohol use can affect fertility. It also affects the health of an unborn child. If women drink during pregnancy, we know that. We hear about that all the time. So people have to be really careful about that. And then bowel obstructions can happen and can cause hemorrhoids and a whole bunch of other stuff that can happen as a result of heavy alcohol use. So when a person drinks, the alcohol is not digested. Alcohol is absorbed. And so the absorption actually starts in the mouth. Anytime a person takes a drink, as soon as they start drinking the alcohol, it starts being absorbed in the mouth. And it is absorbed all along the gastrointestinal system, through the stomach, through the small intestine, the large intestine. As you see, the majority of it is absorbed in the small intestine, 75 to 80%. About 20% is absorbed in the stomach. It makes a difference whether someone drinks on a full stomach or an empty stomach. If someone's drinking on an empty stomach, their blood alcohol content's going to rise faster because it's being absorbed into the stomach. With a full stomach, there's going to be food there that will help to absorb that alcohol. And so it's absorbed more in the intestines as it goes through. So this is an interesting trivia. I always like to do little trivia. Why mix carbonated drinks with alcohol? And people think, well, so they'll taste better, so they're diluted. But actually, the carbonation in the in the carbonated drinks, actually dilates blood vessels. And so it increases the absorption. You're right. I see Connor said it increases the absorption. Yes, it does, because it's opening up blood vessels. And so people started mixing alcohol with carbonated drinks. So it is water soluble. That means it's absorbed and goes everywhere. It makes a quick trip to the brain. And it also quickly crosses the placental barriers, which causes the fetal alcohol disorder syndrome with babies. And if you can see the pictures here, the bottom picture in the middle is a normal fetal brain. And the right-hand picture is the brain of a child with fetal alcohol. This is why they work very hard to prevent this from happening by putting signs everywhere about fetal alcohol. If you, for the women that on here that have been in anywhere where they serve alcohol, a lot of times there's actually a sign in the women's bathroom that says drinking alcohol during pregnancy can damage the fetus. And they put these everywhere. So some of the long-term effects of alcohol on the body, that over time, some of these I already talked about, but the increased risk of cancer, not only oral cancer, but cancer of the larynx, cancer of the throat. And something else that happens with this is the esophageal varices, which is enlarged vessels in the esophagus. It's kind of like hemorrhoids in the throat. It's a dilated vessel. And a person that drinks heavily can actually burst one of those blood vessels and bleed to death very, very quickly. So I've actually known someone that died of esophageal varices. Another thing that we didn't talk about, it can cause people to be overweight because of all the sugar and the alcohol, especially in beer. That it can also cause that beer belly. It can bloat the skin. It can cause muscle damage. It can cause a person to have neuritis or numbness in their extremities, and that causes them to have trouble walking. There's something called Wernicke's encephalopathy, which causes, it's due to a vitamin deficiency in the brain, which can cause balance problems. There's also lack of concentration, depression, phobias. Korsakoff syndrome happens, and it is similar to dementia. It is a type of dementia, and usually a person ends up needing 24-hour nursing care with Korsakoff's, and it is not, they cannot do anything about that. Wernicke's, they can give them vitamin D to help prevent that. It can cause heart attacks. It can cause impotence in men, and in women, it can cause genital distortion. So there's lots of things that go on that we don't think about that happen in long-term alcohol use, heavy long-term alcohol use.